Hi, Mitch here, the retired pharmacist with another video to help you live healthier and possibly longer. Alzheimer's disease is what I want to talk about today. I think that's a very interesting subject and it ties in with all my other videos. Alzheimer's disease is a progressive and a degenerative brain disorder that doesn't occur overnight. Many people want to blame a single reason for this disease. This is far from the truth. Alzheimer's, like many diseases, example diabetes, progresses over time. The symptoms seem to appear more in patients over the age of 65, and that's because it's been developing over time, just like diabetes does. Same way. The factors involved are numerous. Genetic mutation is what people want to blame it on mostly, but it's not true, of the gene ApoE4. Family history, lifestyle, brain injury, or multiple brain injuries like you would get in football. Heart health, secondary diseases like diabetes, high cholesterol, stress, lack of sleep, chemical toxins, excessive alcohol, lack of aerobic exercise, lack of social interaction, lack of mind stimulating, and smoking. All of these contribute to the origination and progression of the disease over time. Alzheimer's makes up 60 to 80% of the cases of dementia. Next, I want to break down how chemistry seems to always fall into the picture because that's how we break down. Chemistry in the brain and the body affect the anatomy and the physiology, leading to the disease. Beta amyloid plaque is a protein that's found in the fatty membranes that surround nerve brain cells. This plaque builds up on nerve cells and stops them from communicating with each other. All the factors I just mentioned increase the plaque over time and destroy brain nerve cells, leading to Alzheimer's. From this, you can now see how many factors over time contribute to this plaque buildup and eventual brain nerve cell death. The symptoms of Alzheimer's seem to appear somewhat in a certain order. This order would help a family member or caregiver recognize the early onset of signs of Alzheimer's. This list is as follows: struggle to remember, planning and organizing difficulties, confusion, forgetfulness, decrease in reasoning skills, problems with simple math, loss of balance, faulty judgment, changes in mood, shifts in personality, severe memory loss, tend to wander around, and inability to respond to basic stimuli. That's the last one. Now we should discuss possible ways to reverse some of the damage and slow down its progression. Regular aerobic exercise has shown to increase brain-derived neurotrophic factor, which helps to remove some of this plaque from the brain cells. I want to move slightly off subject to show how your Paleolithic ancestors, via evolution, use brain-derived neurotrophic factor to increase brain connectivity when hunting for their food. Paleolithic man, after 3 days of hunting, and not eating, would enter ketosis, and the brain-derived neurotrophic factor would increase, making it easier to hunt and kill his food. Also, even more important in this, how to maybe slow it down, is a low carbohydrate diet that will reduce the need for more insulin and therefore reduce the need for more insulin enzyme. Insulin enzyme has been shown to help eliminate beta amyloid plaque on the nerve brain cells. When a person is diabetic, they use up all of their insulin enzyme to break down the extra insulin needed to deal with their insulin resistance problem. This leaves the diabetic patient with very little insulin enzyme to help remove the plaque from the brain. Also, social and mind-stimulating activities help to increase brain-derived neurotrophic factor and improve the brain cells' connectivity. Possible mental balance, such as lack of stress, anxiety, and depression, reduces also the inflammation in the brain, which again reduces it and increases the cognition. Good quality sleep reduces beta amyloid plaque. This is another positive, when people are restless every night. No good. The medications that physicians prescribe are like Aricept, which is a generic as donepezil, and Namenda brand generic as memantine. These are what they call cholinesterase inhibitors. Cholinesterase inhibitors allow the buildup of acetylcholine in the brain to increase brain function, including memory and cognition. The problem with these drugs is they help the symptoms, but do not stop the degenerative process of Alzheimer's. Those cells are dead. Those cells are dying, okay, from that amyloid plaque buildup. So, if interested in this subject, please read the books by Dr. Dale Bredesen, spelled Bredesen, MD, who graduated from the Duke University Medical Center and is renowned authority on this disease. He's actually helped solve cases, maybe 200, 300 cases of Alzheimer's. He's helped these patients. I read his book, The End of Alzheimer's, and was fascinated by his research and dedication to the end of this terrible disease. I am not shilling Dr. Dale Bredesen, and I am not affiliated with him. Okay, this is all I have for today. I hope you were enlightened on the content. When I was a child, many, many years ago, you can tell I'm pretty old, my mother, a master's degree nurse, would always teach me these words of wisdom. An ounce of prevention is worth a pound of cure. You got to get that in your head because it's important. An ounce of prevention is worth a pound of cure, and I'm sure you've heard it, but you didn't really take it seriously. Please give me a thumbs up and subscribe to my channel. Mitch, the Retired Pharmacist, signing out.